Hi, Dr. Frank Johnson from Sport Medicine Ultrasound Canada. I'm going to show you how we scan the median nerve in the forearm down to the carpal tunnel. So sometimes we'll start at the carpal tunnel. The patient is supine with a palm facing up flat on the table. The landmark is going to be the proximal row of carpals. The movements of the probe are going to be some gentle movements until we see the flexor tendons within the carpal tunnel nice and bright and white. The median nerve will shine somewhat differently and is prone to less brightness changes, or it's subject to less anisotropy with movements of the probe or angulations of the probe. We also slide proximal and distal to follow the median nerve as it traverses into the hands or proximally up into the forearm. Sometimes it's even easier to find the median nerve in the mid-forearm and then travel distally, following it into the carpal tunnel. So that's how we scan the median nerve. Going to show you how to scan and inject the median nerve at the carpal tunnel. This is one of the few times I like to have a lot of gel on the patient, and the entire path from the elbow to the wrist needs to be ready to slide the probe across with good contact. I prefer to find my landmark in the middle of the forearm. Patient position is supine, palm up. Landmark is going to be both forearm bones, the radius and the ulna. Orientation of the probe is short axis on the forearm. I can now see my median nerve in the center of the view between the two bones. I'll decrease my depth, and I'll now place the yellow arrow at the median nerve. I'll now slide distal to the carpal tunnel, keeping the median nerve in the center of the screen. You can see the median nerve surface as we near the wrist. It is now sitting immediately below the skin. I'll change the depth of the ultrasound machine. I'll turn up the brightness, and I'll turn back on my arrow to point at the median nerve. We now slide distal into the carpal tunnel, and we can now see the two bones on either side of the carpal tunnel, the median nerve, along with the flexor tendons within the carpal tunnel, and the roof of the carpal tunnel, which is the transverse carpal ligament. The way I inject these is to get the median nerve just off the center of the screen and inject from proximal to distal at quite a steep angle with the needle entry angle like so, and the needle landing just beside the median nerve, while others may prefer to come from the ulnar aspect. So that's how you scan and inject the median nerve in the carpal tunnel.